Well, I think one misconception is that, and maybe that, guns are bad and we should ban them altogether. I mean, some people believe that. I mean, actually, when I think about this, when I was writing in that and thinking about this, I think one of the misconceptions is that you're either for them or against them, and that doesn't have to be the case. What we need to think about is that when you talk about gun safety, it doesn't mean you're taking away people's guns, and when you're talking about gun safety, it doesn't mean you have to take away people's guns. And I think that it becomes such a polarized political issue that if we just looked at this as we look at cars or, it's summertime, swimming pools, we talk about this all the time as well. No one's taking away swimming pools. But we are saying, but we have policies say you need to put a fence around it. And there's some regulations for what that fence can be. It can't be easily climbed over, right? For a small child to easily climb over it. So we don't fight those. In the car example that I talked about in the very beginning, people used to sort of fight wearing seatbelts. And you're probably not old enough for those days. I'm old enough where there weren't seatbelts in cars, and we didn't have any concept of what that was. But in the early days, they were really literally just belts, and then they became straps. They engineered cars so that the shoulder strap would be automatically moved when you close the door, and it would come across. And people would, at first, were like, "You can't tell me what to do. We're sort of a very independent nation, and sort of in our culture, you don't tell us what to do, get government off our backs." And people used to buckle behind them, and they used to figure out always, as if it was like, who you hurting? I mean, this is all about safety. This isn't about taking away the car or anything. But over time, we changed our culture to there isn't probably a child in America who doesn't get in a car and buckle up. There isn't probably a citizen in America who doesn't get in a car and just automatically, muscle memory, buckle themselves up. And if you own a gun, to automatically lock it up, to automatically keep the bullets separated. I mean, these are not, this is not rocket science. We just have to have the will to do it. So I think there's a misconception that when we talk about safety, we talk about data, we talk about the research that we need to do, that it turns into, you're trying to take my guns away. And it just ain't so. It's certainly not what we're talking about. We're talking about gun safety, and our facts you didn't even ask me about the facts stuff. Rebecca and I are co-PIs on that project. She'll probably talk about it a lot, so maybe I don't need to. But our motivation to work on facts is the data about children and about gun safety, and the data on gun safety, and the absolute lost generations of researchers. It's not only that we've not done the research, but because there was sort of it was almost taboo not to do gun research, because A, there was no funding, B, it was such a hot button issue, and C, you would be attacked if you did it and you shouldn't do it, and it's not a way to develop your research career. So we have a lost generation or two of researchers who could have done doing this research, who've done the car research to make them safer. I mean, cars are pretty safe today. And I don't know if you've driven in any new cars or rented a new car, but there's the blind spot indicator. I mean, that's like almost standard in cars now, right? And why? Because we know that blind spots is where some cars crashes would occur. So we created safer cars as a result of that. And so the FACTS initiative was really designed to start filling in that gap and create a generation and momentum towards people doing research on this, bringing people together, 12 or 15 universities around the country, criminologists, public health professionals, physicians, psychologists, all coming together who are doing this work and identifying areas of need to sort of start to prime and kickstart the field. Congress is starting to get into the mix. There's a bill right now to fund it. Very, very small amount of money, honestly. It's $50 million. That, relatively speaking, that's not very much money. I realize that that's a whole lot of money and could do whole lots of things. But there are way more dollars spent in, say, drug use, National Institute on Drug Abuse, in the National Institute on Alcohol Abuse and Alcoholism, in just about any other kind of disease, cancer. And we need that kind of effort, because I think it's going to be, it's a heavy lift. We haven't done very much of it, and we just need to have a lot of brains working on it. And it's that building up of knowledge that's really going to make a difference. And, let's get 7 kids die a day instead of 8. And let's build towards 6 and 5. And the goal, of course, is 0. We can't do it without really knowing what's kind of going on with that.